Integrative medicine, we usually try to think about it in terms of bringing treatments that are outside of the conventional sort of sphere of medicine, bringing them together with conventional medicine in order to give more options to patients. A lot of the types of therapies that we usually consider part of integrative medicine would be what therapies that we think about as like mind and body therapies. For example, therapies that combine an approach to managing, for example, pain, using both body-based treatments such as massage or chiropractic treatments, combined with perhaps some interventions that help people develop more mindfulness, or like meditation. Other types of integrative therapies are what we call whole systems. So these are mostly traditional healing sort of systems that have been in existence for thousands of years, such as acupuncture, for example, or Ayurveda in India, or some indigenous types of healing systems, for example, here in Native American cultures. Research, in our opinion, is key because we need to understand, first of all, whether these treatments are effective or not. And we need to also understand the underlying physiological basis for these treatments. There are groups that are studying the effects of meditation on chromosomes and some of the aspects of chromosomes that determine, that have to do with aging, and find that meditation actually helps the chromosomes to maintain their integrity. And so this is research that now is going in many different directions and to understand the physiological effects of meditation. Looking at another treatment, acupuncture. Well, acupuncture for a long time was really struggling with sort of proving that, well, when you insert needles, are you simply having a placebo effect? But the question then became, is there something about inserting the needles that is beyond simply a placebo? And for years, there was a lot of controversy surrounding that because a lot of the studies that were comparing acupuncture to what we called sham acupuncture, where you're pretending to insert needles, but you're not really inserting them. Was the true acupuncture better than the sham? And that was open to question until recently. There's been a very definitive, what we call a meta-analysis, where they put together data from thousands and thousands of patients all together, and they analyzed them as one single study. And that really showed, conclusively, that the acupuncture treatments were superior to sham. In my lab, I do research on connective tissue and chronic pain. And the reason for that is because I became interested in what happens to connective tissue when during an acupuncture treatment. It turns out that acupuncture needles interact with connective tissue in a very interesting way. The needle interacts with the tissue. The needle actually causes mechanical stimulation of connective tissue, and there are cellular responses that occur in the tissues as a result of that. The other thing is that we found a correspondence between the ancient sort of system of what we call acupuncture meridians and connective tissue planes in the body that separate muscles. And so this is, I think, important to move the conversation along. It's not the only thing that's important. As I mentioned, it's very important to also to understand what happens physiologically when patients undergo acupuncture treatments. But it was very important, I think, to show that the effects can be demonstrated clinically.